Thank you very much for this opportunity to talk about the engagement study, specifically the Virtual Genetics Board that was launched nationally. This was funded by a grant from the Department of Defense and included a multidisciplinary team of experts to come together to talk about cases regarding genetic testing for prostate cancer. The link to the Prostate Cancer Genetics Engagement Study Virtual Genetics Board is shown here. My name is Veda Giri. I am Division Chief of Clinical Cancer Genetics at Yale School of Medicine and Assistant Director for Clinical Cancer Genetics for Yale Cancer Center. So I'm going to talk about the rationale for the Virtual Genetics Board, which is that germline testing for prostate cancer has really become central in terms of impact on treatment, screening, and hereditary cancer management. And there's been a recognized growing need for a spectrum of providers to develop a working knowledge and understanding of the considerations of germline testing and genetic counseling for prostate cancer. So this virtual genetics board was developed to provide case-based discussions about prostate cancer germline testing, standard of care and clinical trial management and options, hereditary cancer management, and genetic counseling. Case complexities were also discussed in each conference to address the nuances that are encountered in practice. So this genetics board was launched and included experts in GU medical oncology, prostate cancer genetics and genomics, radiation oncology, urology, clinical trials, genetic counseling, and molecular oncology. And you can see here the list of experts is really phenomenal who engaged with us for this virtual genetics board. Providers across the spectrum of care, mid-level providers, genetic counselors, students, trainees are all invited to participate in the virtual genetics board. The live recordings have completed, but there is a library of these recordings that is available at the website that I showed, and I'll show you again at the end. Conferences were held monthly, and the cases covered genetic considerations in metastatic prostate cancer, high-risk disease, early-stage disease, and in prostate cancer screening. We also discussed how paradigms of care delivery were applicable in terms of thinking about genetic counseling and point of care implementation of germline testing. Anyone who joins these virtual genetics board recordings and takes a listen to the recordings is invited to complete a baseline survey and also then complete a post-conference survey just to assess, did these conferences impact knowledge, feedback on the cases, and the impact in practice. So the engagement study covered a spectrum of topics. This just shows through March of 2022. And as you can see here, this really includes a spectrum of cases, as I mentioned, from metastatic to early stage disease and screening. We routinely covered germline testing criteria, post-test, pre-test counseling elements, family history collection, germline testing panels and considerations of which panels to choose, gene-related prostate cancer management and hereditary cancer management, clinical trials that may be available. Case complexities were always discussed, and these are really important in practice. For example, VUS interpretation, incidental germline findings, how do we incorporate cell-free DNA test results, and then results related to management for genes that are maybe a little bit more obscure or have less data, such as other DNA repair genes. We also discussed germline classification criteria and the importance of cascade testing. In terms of the clinical application in practice, as you can see here, this is just an example of one of the ways that we actually took an approach where we went through the flow in practice for a patient with advanced or metastatic disease, looking at the testing criteria and therapeutic options, and then looked through this from a point of care lens, as well as referral to genetic counseling. What elements were common to obtain and what might be different, along with a collaboration between healthcare providers and genetic counseling. We did a preliminary assessment of the utility of this virtual genetics board that was presented at the ASCO GU conference in 2022. At the time that these results were reported, there were 57 participants who had engaged in the virtual genetics board. There currently are 100 participants, and we have room for up to 200 participants. So we invite any healthcare providers or folks that are interested to learn about these cases to please join. We did find that knowledge scores increased regarding cancer inheritance, rates of mutations in metastatic disease, BRCA-related cancers, risk of prostate cancer in HOXP13 carriers, and risk of prostate cancer in African-American families. Overall feedback was really positive about the virtual genetics board, with over 90% favorable responses regarding usability of the technology, usefulness of the case discussions, and relevance to the informational needs. And really importantly, 83% of the participants reported that they plan to implement the knowledge that they gained from these virtual genetics board in their practices. So we found that the initial results of the virtual genetics board are really important in terms of the value to increase prostate cancer genetic evaluation knowledge. Our current goal is to enroll 200 participants. So we have slots available for 100 more individuals to be able to log in, join, and listen to the library of virtual case recordings. And those recordings are available here at prostategenetics.com/engagement. And we welcome anybody who's interested to learn more to take the assessments before and after, so that we can really get a handle on the importance of this particular approach. Thank you very much for your time.